Hello all, as promised, this is a new video on ethics related question. So when solving ethics related question, there are a few principles you need to understand. There are a few things that you need to keep in mind so that the question becomes easy. So it's not so tough. You have to understand the principles and then apply it whenever possible. So the basic 4 principles of ethics, as you know, are beneficence, non-maleficence, justice and autonomy. Now what do they mean and how it implies to certain situations? Beneficence means you are doing or intending to do good to the patient. Okay, so your ultimate aim is to do good to the patient. What is non-maleficence? Non-maleficence is when you are avoiding harm to the patient. So you are intentionally avoiding any harm that can come to the patient by your actions. What is justice? Justice means you are treating your every patient irrespective of their gender, caste. That means there is no discrimination. You are utilizing the resources among your patients irrespective of their status or anything that they come with. You're just treating your patients equally. That is justice. What is autonomy? Autonomy means the patient has every right to choose what can happen to their body in terms of their examination, investigation, as well as treatment. For that, you need to have an informed consent, which almost always must be in a written format. So you have to explain to them the kind of procedure or the kind of investigation that is going to happen to them. You're going to explain the process, the benefits, the risk that can come with it, the amount of risk in terms of mortality, as well as what can happen if they choose not to undergo that treatment or investigation. So everything has to be discussed prior and they have to make a well-known informed consent so as to proceed regarding their management. So that is one thing. And there is another thing which is confidentiality, which also comes as a part of autonomy, as you can see. Confidentiality means the patient has their right to know their disease as well as to choose not to disclose it to their family members. And the right mainly lies to the patient if the patient is mentally competent to understand their problems and also to make decisions for themselves. So if you have, say, a daughter coming to you and saying that my dad is very ill and he's already very old, so if it's a grave diagnosis, I don't want you to disclose it to my father. What do you choose to do in that case? Even if the patient is old, even if the patient is frail and have other morbidities, that doesn't take away their right to know their diagnosis. So you have to discuss to the daughter why they are thinking about not disclosing. You have to have an open communication with the daughter, but also make sure that the patient has the right to choose whether they want to know the diagnosis and whether they want to disclose it to their family members. So the main right always lies on the patient if the patient is mentally competent to make decisions and to understand their problem. So these are the main things. Now we'll take up every single scenario and discuss in detail how to go about it. This is about the ethics part. After we discuss this 4 main principles, that is beneficence, non-maleficence, justice and autonomy, we'll also discuss medical negligence and medical errors. Okay, with that we'll conclude the session on ethics. So let's get started with the questions one by one. So let's get started with the scenarios. We are mainly using the 4 basic ethical principles, which is beneficence, non-maleficence, justice, autonomy, and extended to that we have good communication, getting an informed consent, and keeping the confidentiality. Now, the first scenario, increasing the dose of opiates for pain management despite the risk of respiratory depression. So, the clinical question can be that there is a patient who might be, usually suffering from cancer or end-stage disease, and they are in severe pain, and they are receiving opiates, but they are not having adequate pain control, and they are asking you to increase opiates, and you discussed with them that it might cause respiratory depression in the patient. Despite that, they want that increase in opiates. So what will you do? So in this case, it is you may think that it is beneficence versus non-maleficence. You are intending to do good to the patient, but it might also harm the patient. But in this case, when the patient is terminally ill, in severe pain, pain management becomes mandatory, because you are to give some relief to the patient, if nothing else. So you can increase the dose of opiates despite their respiratory depression for adequate pain management. Now, this may come as a part of passive euthanasia also. Now, that can be legal and permissible, because your intention is to do good to the patient. To give in this case, you are choosing to increase the dose of opiate. Now, another scenario can be regarding justice. Two patients who are allotted for liver transplant. One is an elderly lady with so many comorbidities who is very unlikely to make it after the treatment. Their survival rate is very low. Versus a child who is having some kind of poisoning or intoxication, and they have liver failure, and now they need a liver transplant, and their chance of survival is very high. Now, in this case, when you're doing justice, you are likely to choose the patient who has a better survival, who has lesser comorbidities, and likely to benefit out of that treatment, rather than blindly going behind justice. When you have limited resources, you have to allot based on the priority, based on their medical priority, not based on their discriminatory things like their race or status or gender, whatever. You have to choose based on their medical priority. That's why you are also triaging the patient who are coming to your emergency bay. Next, regarding autonomy. There can be different scenarios regarding the do not resuscitate situation. Some patient who is brought unconscious, they have a tattoo on their chest which says do not resuscitate. Now, in that case, do you resuscitate the patient or do you not? The answer is simple. Tattoo is never taken as a document, not as a legal document which validates the DNR status. It has to be written, it has to be signed by the patient. So this DNR cannot be taken into account. So tattoo you are disregarding and you are resuscitating the patient. Now, another thing is, there is a patient who is already on DNR status. Now their oxygen saturation is low. Will you give oxygen to the patient? There may be different options like oxygen administration, do not resuscitate because they are having a DNR status, and so on. What will you choose? So remember, do not resuscitate do not mean do not treat. Do not resuscitate means in case of a cardiac failure, you are not resuscitating the patient. Okay, that is what it means. Sometimes it can be written as DNR and DNI. That means do not resuscitate and do not intubate. Especially when you're taking a DNR consent, you have to make sure what are the do's and don'ts that you can do for that patient. It has to be made very clear from the side of the patient what they expect in terms of treatment. What all can you do? What all extensive treatment can you do in terms of investigations and treatment, and where do you need to put that stop? Okay, so you have to make a full code for the patient. What all needs to be done, what all needs to be avoided. Just simply a DNR doesn't mean do not treat. You have to give basic treatments, basic antibiotics, basic workup to the patient that can, save the patient. It doesn't mean you end your treatment abruptly. It only means that you're not resuscitating the patient if at all there is a cardiac arrest. if the patient already has a living will or an advance directive of what all needs to be done to them, maybe during their prior admission or otherwise, some patients, elderly patients, might have made a living will of what. So if the patient already has a living will, always respect the patient's choice. Not, they might have a proxy, a close relative who is, having the attorney to decide for them what needs to be done. Next is regarding autonomy. Again, a different scenario. Suppose a patient, a child of 10 years, who is a Jehovah's Witness, which means due to their religious belief, their parents are denying any kind of blood transfusion to the patient. But blood transfusion at this point to the child is of an emergency. Now, what do? Do you go by the parents' decision to not give them blood, or do you give blood because they are a minor and giving blood at this point is life-saving to the kid? So in this case, despite their beliefs, despite their resistance, you can't deny that treatment to the child, because this child cannot choose on their own, and it is a statement of life and death, and then you have to choose in favor of the child despite their parents' resistance, because legally you are bound and you are okay to give blood to the child, even if they are resisting, their parents are resisting. Again, in another scenario, when the patient is unconscious or the patient does not have the mental competence to decide for themselves, then you have to choose on the part where what will be more beneficial to the patient. You don't have to choose autonomy because they don't have the mental competence to choose for them. So those are the two other scenarios where you can have a conflict. Now, regarding confidentiality, an HIV patient is telling you that please do not disclose my diagnosis to my sexual partner. Now, in this case, what do? Do you respect the confidentiality, or do you disclose it to the partner because of the risk that it poses to the partner? Now, in this case, though HIV is notifiable and it can be spread to the partner, you are not allowed to disclose it before the patient gives you permission to. So it again falls on the patient's confidentiality. You can encourage them, you can talk to them what happens if you do not disclose it to your sexual partner. You can talk to them about the complications that it can pose their partner to, but you can't disclose it on your own. It is the patient's confidential information and you have to respect that. Now, a little bit regarding good and open communication. If there is a patient who is asking you to end it all, they don't want to suffer anymore, they are terminally ill, they are having severe pain, what do you do? Or if you have a bystander who is asking for DNR and to stop all the treatment that their mother or father may be receiving, what do you do in that case? So first thing, always among the options, look for communication, because open communication is always the key. You have to discuss them, why they think so, ask them for their input, and then give your input as to why you think continuing the treatment may be necessary for them. Or in case of a patient who is having chronic pain, they are asking to end it all, see if they are having adequate pain control, because pain management is of utmost importance when it comes to terminally ill patients. So again, communication is the key. So to sum it up, ethical principles, mainly you have beneficence, non-maleficence justice, autonomy. In addition to that, think about the key terms like communication, confidentiality, and informed consent. These are the things that you keep in mind before answering ethical related questions. It does not come just in EMREE MCQs, it also comes as a part of multiple mini interviews wherein you are given scenarios based on different ethical principles and you will be asked to give your input. So you have to use these principles and then elaborate your answer and justify your answer why you take a stand. Because in ethics, it's not right and wrong, it's what you can justify. Whatever action you're taking, how you can justify. Basically, it's to do good to the patient, it's to not do any harm to the patient, do justice to the patient, and respect their autonomy and keep their informations confidential, and have an informed consent, and always opt for open and good communication. So this is the thing. We'll talk about medical errors and medical negligence in maybe in the upcoming videos as scenarios, and we'll see how to deal with that as well. So for today, thank you so much, and subscribe if you need to watch more content on EMREE, and if you have any content suggestions, you can put down in the comment. Thank you so much.